So Calvin, he had a cerebellar tumor, sizable tumor in the back of his head, in the part of the brain called cerebellum, which was troubling him 3 years ago with severe headache and difficulty in walking, swaying while walking. And he underwent a surgery.
He was really not doing well, so when I get back home, I take him over to the mainland of Honduras and get a scan of his brain, and we found out that he had a tumor in his head. We was in a government hospital for a month, and they didn't do anything with it. The hospital just ran out of funds, and they didn't have anything to operate on it with. There was no space in intensive care. So then they just told us that we would have to find somewhere else to go. We had to go to one of the private hospitals in San Pedro, which ended up costing us roughly about $22,000, which up to this date I'm still paying on. And then we found out the first part of this year that he had a tumor regrowing in his head. So I worked up here for a few years with Captain Eugene Ebanks, and they called me up and they told me about the program that they were doing here in the hospital. And thankfully we was able to get him up here, and Dr. Komal did a really good job on him, so we're very happy and very appreciative of everything that they have done for us.
So we had to go in, use operative microscopes and take out that part of the tumor which was growing again, and the tissue has been sent for histopathological examination, and depending on what that report comes, he will be subjected to further treatment if required. So we are very happy that he could come out of ICU on the first after 1 day after surgery. It's a major procedure in one of the very important areas of the brain, and the two re-explorations are always a little uncertain about the outcome. So, and we did a scan which shows good response, and we are happy that he is back in the ward at the earliest possible time. Whatever we intended to do has been done. The tumor is taken out, the solid part which was troubling. Now the next major step is to wait and see what the histopathological report comes. So there may be bits and pieces of tumor stuck in there, and if it's a dangerous version of a tumor, that will require further treatment in the form of chemotherapy, that's with injections and tablets. And now he has been subjected to radiotherapy also, even that will help in the future. Going by the report what we have in hand, which is of the previous biopsy report, it's a very good tumor. It's a sort of benign tumor, but in a bad location, because anything in the brain is dangerous. So otherwise it's a grade 1 tumor, pilocytic astrocytoma, which means if the present histopathology comes as the same, it's really good news, because the chance of it troubling again is much less.